everyone for joining today. Welcome to this week's session. I am thrilled to be joined by our Revenue Cycle Product Manager, Bimal Sahoo. And this week, we're going to talk about a topic that I know keeps a lot of healthcare providers up at night, and that's bad debt. We're going to focus on how insurance discovery technology can drastically reduce your uncompensated care. So welcome, Bimal. Glad to have you back.
Thank you, Kate. It's always a pleasure to be back on office hours.
Well, we're glad to have you. So let's get started. I think probably the best place for us to start is to have you explain what insurance discovery is.
So typically, insurance discovery is a term that we use in the revenue cycle industry, defining as anything that helps us to discover or uncover coverages for accounts that have gaps in terms of either eligibility or missing information that prevents those claims to go out to the right payer to get paid. So insurance discovery, it kind of constitutes a multiple set of things, not just finding the right payer, but also rectifying certain patient demographic information or anything missing in some of the important fields that go into the payer claims to be rightfully getting paid. So that's in a nutshell insurance discovery for you.
Thank you. So what uncompensated care trends are we seeing right now?
Uncompensated care is a growing trend that we are seeing, right? So since the beginning of the century, if you take from 2000 onwards, we would see hospitals across the US have lost more than $720 billion worth of net patient revenue because of uncompensated care. Last year, probably 2000 alone, I think we lost more than $43 billion just because of uncompensated care. And this could rightfully be under the charity care territory, in which most hospitals contribute to provide free services. But at the same time, a lot of these bad debts and uncompensated care is occurring because of eligibility gaps or coverage gaps that we see across patients.
Definitely not trends that are positive for sure. So how can technology help avoid bad debt and charity write-off?
Yeah, so if we understand the landscape a little better, so what happens is most of the healthcare providers, which typically see around 10 to 15% of their accounts under self-pay, out of which they would probably assign 2 to 3% to bad debt and charity care, which is acceptable. But on the other hand, they also kind of receive a whole lot of eligibility denials, wherein they don't have the subsequent payer information to rightfully, bill the claims out. So what happens is there is a growing trend of accounts which have been misconstrued as self-pay because the patient either did not reveal their true payer at the time of scheduling and registration, or you could have filed with the information that you have in your in your system, but typically then got an eligibility denial, be it like coordination of benefits, or they're unable to ID the patient, or some identifier in the patient demographics are kind of missing. So in all of these scenarios, what you're typically having is a bunch of accounts, probably like 8 to 10% of your total revenue, for which you are marking them as self-pay, and you're going after patients, sending them patient statements, or moving those accounts to collection agencies to recover. And as you know, like these are very typically costly affairs. Setting up patient statement is like $2.5 to $3. And probably you have to send more than 2 of them to the patients to recover anything or get a response back. Or you may have to call the patient, and if they're kind enough to provide you with the right information, then probably you can bill the claims out to the right payer. or in some cases you may have to move it to the collection agencies, and they can probably give you a success rate of 10-20% and will still charge like a hefty 30 to 50% of what they recover for you. So what's currently happening is around from all the accounts that are tagged to self-pay because of various reasons around eligibility rejections or unbilled accounts, or clearinghouse rejections, or the misconstituted self-pay accounts, hardly 20 to 30% gets collected. Patients are kind enough to kind of pay that post the service is done, but the rest are being written up. And that trend we are seeing, as I mentioned a little while ago, is kind of growing, and we are seeing, it was 38 billion dollars in 2017, 2018, has grown up to like 43-45 billion dollars in the past 2 years. So that's something, is a challenge right now what the providers are facing.
What types of technology are typically used in an insurance discovery solution?
Typically, an insurance discovery solution will kind of combine a few things, right? So it will combine a set of your ability to go and check through other sources of information from where you could get the correct payer information and the patient demographic information to rectify on your claims, so that you can send the corrected claim back to the payer to get paid. It typically will involve you or your vendor to go across multiple databases of claims that have been historically processed, from which you can probably extract the right information that you need, so that you can go after that information and get paid for yourself for the claims that are or the accounts that are withstanding with you. So there are various vendors out there in the market, but typically they're more clearinghouse specific solutions, which means that if you go across any vendor, their expertise or their knowledge base or database is only limited to the networks or the claims that gets filed through their processing systems or their clearing houses. So in essence, it's a bit fragmented if you go across just one vendor, and typically you should connect with different vendors, and vendors provide you with portals or with API solutions, wherein your accounts that you want to have insurance discovery for, those accounts you can trigger through a HL7 message or through an API, call the vendor, and probably you could get a successful response back. We typically see around 20 to 30% of return coverage if you kind of combine 3-4 vendors together. But that's the success rate that most organizations who employ multiple vendors kind of see. Now, there are multiple other challenges around billing, which I think probably is a conversation for another day. But that's the technology offerings that are out there in the market that providers should definitely go after and check out to ensure that the self-pay accounts and eligibility rejections can be minimized at their end, and they do not have to incur bad debt and write off dollars.
How can insurance discovery technology impact the patient and improve patient satisfaction, which is always top of mind for providers?
So imagine like you are a patient and you have gone to the provider, you took a service before the service was rendered. They did all their processes around patient access, they did the registrations, scheduling, they took your insurance information and you provided some details, maybe you had paid some co-pays. And at that point in time, you are not expecting to get a bill of statement after the service is rendered, because you are expecting that this is all I am owed to and I already paid it. But what happens is since those information was probably not collected correctly by the provider, or they didn't ask you for the right information, or maybe it was a miss from your end to provide them with the right primary or secondary, so then the provider is on the hooks, because when they send the claim out, they are either getting a rejection or they're not getting paid. So they're going to come back to you as a patient, sending you patient statements, right? And it's not a pleasant conversation, or you don't want to look at those statements coming your way, because you're scratching your head, what did I do wrong? And in most cases, patients don't pay, because the liability has shifted to the providers after they have done the visit. So in those cases, mostly the providers are there to lose, right? But it's a burden on the patients, because if somebody is receiving those patients and they were supposed to make those payments out, or if a collection agency deployed by the provider is coming after you, it's not a pleasant experience for you, right? So it's a burden that you had not thought of earlier, but now you may have to pay out of your own pockets. So if through insurance discovery, providers can find alternate coverages and rectify the claims and send it out to the right payers, then the patients are kind of covered and they don't have to shell money out of their own pockets. They are happy, their satisfaction increases. And on the other hand, providers for those discovered accounts can directly get paid from the payers. And it's a win-win for both parties, because payers generally pay on time. Patients take more time to kind of pay things out. And it's much easier to collect from the payers directly, and you're going to collect in full, and you're going to get paid on time. So it's a win-win for everyone, and the patient is kind of satisfied more because he's not receiving those statements out, and his burden financially is substantially reduced in those cases.
So if I'm a healthcare provider and this all sounds like something I need to implement, what should I do to vet an insurance discovery solution? Because there's obviously lots of choices and it can be hard to know what to look for.
So when you want to apply insurance discovery, first, it's important to benchmark what the opportunity is, right? And your opportunities could lie across many use cases. One is, of course, the self-pay accounts or the population that's kind of out there. But on top of that, you could also add in certain other use cases, for example, eligibility denials, where you don't have a recourse to file to another payer because no other payer on file exists. So those accounts also you can run insurance discovery for. You can also kind of run insurance discovery for eligibility COB, coordination of benefit kind of denials that you kind of receive and you don't have the secondary information. You could also run it for unbilled accounts that are out there, or clearinghouse rejections around eligibility that you may be using. So combine all of that together and kind of assess what that opportunity looks like. And once you've kind of done that, it would then be good to kind of connect with a vendor, evaluate what their discovery rates are. You may have to kind of compare different vendors, and they're pretty easy to kind of reach out and do a sample pilot for you. And once you have done that, you could either go through a batch process, or you could go through through a real-time API integration with your billing systems. Now, there are typical use cases around that. If you are kind of wanting to do a insurance discovery at the point of care, you'd probably want to do a API integration or HL7 integration, so that it's much more real time for the front end staff to update that information, update the insurance information. But in other cases, after the service has been done, if you want to rectify those information out, or those uninsured accounts you want to do insurance discovery for, you can you can follow a batch process where you can send a batch file of all those accounts on a periodic basis to them, and they can provide you with the coverage information. But the other thing that I want to now kind of bring back is there are different challenges around those responses. Typically, a software-only solution might not be best suited for you, because when vendors provide you with the responses, they would provide you with various coverages. You could get like a primary information, could get secondary, could get tertiary, but it's difficult to kind of determine that from the possible coverages that they send back. So your billing team, when they are receiving those responses back, they need to be a bit of experts to kind of determine what the right primary or the right secondary is, so that they are billing it correctly. And also, before billing those claims out, you need to also ensure that was prior authorization really required for some of these claims, because if it was required and you didn't obtain it earlier, then in those cases, you're going to get an authorization denial back, and it's going to be more work for you, right? So so the couple of different scenarios, even like timely filing limits, if those accounts are really old, then you need to ensure that you're filing those claims out on time before the timely limits of those payers are expiring. So few other considerations around payer guidelines. These need to be taken care during insurance discovery billing before you send those claims out. So a good combination of a good vendor relationship, as well as some knowledge and guidance and expertise from your billing teams, should help you recover more money that you earlier were not even realized.
Thank you so much, Bimal. This was super insightful and helpful. Lots of really good tips. So thank you again for joining us.
Thank you.
All right. Have a wonderful evening, everyone. Bye-bye.